What if I told you that touching your pen before any procedure in OSCE will render your station a fail? Yes, I'm talking about implementation station in OSCE and all other medication administration station during your OSCE. My name is Gentle. I'm one of the lead trainers at Gentle OSCE Trainers, one of your favorite OSCE training group here in the UK. Touching your pen during an implementation station in OSCE is considered a malpractice. On the clinical settings, before you document or you sign that patient has taken the medication, the nurse associate or the midwife need to confirm that indeed the patient has swallowed the medication before you put your pen to paper and document that patient has received the medication. In OSCE, you don't have to touch your pen until your patient have received the medication, and you, the nurse, have confirmed that patient has indeed swallowed the tablet. So after you've read the prescription, you dispense your tablet into the medication pot, okay, and you give the medication to the patient. Please make sure patient have swallowed before you touch your pen. Here is the deal. Most candidates complain that they tend to forget the medications they are giving. That is why they try to pick their pen to mark the areas or the prescriptions that are due at their time. That is wrong in OSCE, and that will render your station a fail. How do you combat this? I always advise during lecturing that, or during our discussion, that after confirming that your prescription is valid and you are safe to administer that medication, you go to the medication trolley and pick the medication, validate it by mentioning the expiry date, batch number, the minimum of the medication, and then the strength in which the medication comes. Then you state that it is safe for you to administer. Then you dispense the number of tablets you need into the medication pot. Don't send it back. Don't send the medication bottle back to the medication trolley. Place it on top of the trolley this way, this beside the bottle. So you place the medication pot together with the bottle on top of the medication trolley, so that after giving the medication to the patient, this bottle will be on the trolley. So you know that you have given drug clarithromycin 500 mg, so that you will chart accordingly on your medication administration and record charts. You don't need your pen to take the prescriptions you are giving. That is a fail. So please make sure you do this simple trick to avoid any failure when it comes to implementation. I take it again. During implementation station, never pick your pen until you've confirmed that the patient had swallowed the tablet. If the tablet hasn't gone down, then it means patient has not received the required medication. Therefore, you don't need to sign. So if you pick your pen before giving the tablet, the assessor considered it as that you are signing before giving. So this happened to this candidate. You see the feedback up there. Yes. So he or she said that she took the pen, taking or marking the prescriptions that are due at his or her time, to make sure that she doesn't miss them during documentation. That is a straight fail. You'd have to confirm that your patients have taken the drug before you pick your pen. So in implementation, I always advise that not even your name, unless otherwise your assessor tells you that, okay, before you start this procedure, put your name on the paper. Then in that case, you are safe as per assessor's instruction. If the assessor doesn't tell you to write your name, not even your name, because your name is also part of the documentation in OSCE. So make sure you are done with the procedure. Confirm patient has swallowed the tablet before you pick your pen. Please, going to pay £400 for a receipt because you picked your pen is some way, isn't it? So please make sure we do the right thing. Thank you.